What are the best uses for rectal ozone insufflations? Rectal ozone insufflations are one of the most popular home ozone treatments, but most people unfortunately use them mostly for systemic treatments. And I don't think that this is the most effective way to use them. Instead, I believe that using rectal ozone insufflations for local treatments is the most effective way to use them. I'm Paula, the crazy ozone lady from thepowerofozone.com, and in this video I will explain to you anal aficionados how to best use this rectal ozone deviation to get the most out of it. And to be prepared to get pissed, because what I will say here is not a popular idea, and I have been criticized for this idea many times. Namely, the idea that rectal ozone insufflations are not a powerful systemic treatment. Before we start, all you anal ozone fans, please sign up to my newsletter, become a member of the Ozone Rebel Gang in case the Ministry of Truth and Justice, aka Big Tech overlords, will purge ozone therapy from the internet. So just go to thepowerofozone.com/news or follow the link below in the description. And also a disclaimer, I'm not Bill Gates, hence this video does not constitute medical advice. So please don't use this video to prevent, diagnose, or treat any illness. Instead, visit your friendly but most likely heavily brainwashed local big pharma drug pusher, aka your medical doctor. So back to the program. That's right, in my opinion, rectal ozone treatments are not a strong systemic treatment, and it's not the best way to use ozone at home, in my opinion. Now, just like some of you, I've pushed a good amount of ozone up my butt in my life, and I'm proud to say this, I stand by this. But in most cases, I do not recommend that people do rectal ozone insufflations for systemic treatments. I believe that in many cases, it's a waste of time, and in some cases, it can be a pretty tragic waste of time. And I will give an example for this a little later on. So yes, I'm not a big fan of rectal ozone insufflations as a systemic approach, but there are certain local conditions where I believe that rectal ozone insufflations should absolutely be used. And I believe that those few conditions absolutely call for rectal ozone insufflations, and where they should be used as the primary, number one, most important ozone treatment. And so let me list them off, and I've taken many of them from the Madrid Declaration of Ozone. So I believe that for the following indications, rectal ozone treatments should absolutely be used. So benign prostatic hyperplasia. So this is one condition where rectal ozone could be very effective. So benign prostatic hyperplasia is basically a condition where the prostate grows, and this is not a malignant growth, this is a benign growth, hence the name benign. And so the symptoms can be very similar to, for example, prostate cancer or prostatitis, so a prostate inflammation. So there can be some urinary problems, problems with emptying the bladder. And so I believe that rectal ozone insufflations can be quite effective in this case. Another indication is colorectal cancer. Colorectal cancer in most cases is in the lower part of the colon, so very near the anus. So this is also a part of the colon that can be easily reached with rectal ozone insufflations. Now, I'm not saying that ozone is a valid cancer treatment. There's a thought crime to state such a thing, but some people do choose to opt for ozone. Some people have just exhausted all other options like chemoradiation or surgery, and the cancer have come back, and so they choose to do ozone therapy. And so in this case, I believe they should have the option, they should have the choice, of course, to be able to do this. And so with colorectal cancer, I believe that rectal ozone insufflations, not any other ozone treatment, that this should be the main way to go about this, to really increase your chances of possibly being successful. Another indication for rectal ozone insufflation is constipation. So this is something that I've experienced myself. I have suffered from severe histamine tolerance at times, and one of the problems was constipation. And so really rectal ozone insufflations, they often offer just an immediate evacuation and are just a great remedy for constipation. Another indication is Crohn's disease, which is characterized by an inflammatory response in the digestive tract. And so ozone therapy, being an anti-inflammatory therapy, can greatly help with symptoms of Crohn's disease. I don't believe that it can cure Crohn's disease, but it can help manage the symptoms considerably. Another problem is diarrhea. Diarrhea, for example, because of some infestation in the colon, some parasites, then I believe rectal ozone administration would be a good way to try to treat this. Irritable bowel syndrome, similar as with Crohn's disease, it can also help manage the symptoms. Another indication are intestinal parasites. If the intestinal parasites are in the large intestine, then I believe that rectal ozone insufflation would be the primary way to try to address those microorganisms. Another indication is proctitis, so inflammation of the rectum and anus. This is, again, another way where rectal insufflations would be a direct way to treat this local problem. And also prostate cancer, really basically everything that has to do with prostate. So prostate inflammation, prostate cancer, benign prostatic hyperplasia, prostate infection, if there is such a thing, then a rectal ozone administration would be the direct way to address this. Another problem is ulcerative colitis. So this is another local problem that sits in the colon. And so here again, rectal administration of ozone could take care of the symptoms directly. But yeah, so just to recap, basically everything colon and prostate related. If you've been to a doctor to have a prostate exam, then you know that the doctor, when he examines you manually, then he goes through the rectum because the prostate sits so close to the rectum. So he can directly palpate, he can touch the prostate by going through the rectum. And so you use exactly this very fact with rectal ozone treatment. So the idea is that by introducing ozone gas into the rectum, you will saturate the entire area around the rectum, and so you will also touch the prostate. You will also have an impact on the prostate, and so that the beneficial ozone byproducts will also penetrate the entire tissue and enter the prostate, and so resolve any possible inflammation in that region. Another indication that is listed are anal fistula and anal fissures. Now, I agree with the anal fistula. So fistula basically are tunnels or canals that are formed between the colon and the outside skin. And so yeah, so rectal ozone administration would be a very good way to treat this. I believe that this should be the main way to treat this kind of problem. But with anal fissures, I would not necessarily use rectal ozone insufflations. There I would probably just use ozonated olive oil. So I would just dip a finger, so put on a glove, and then dip the finger in some ozonated olive oil, and then digitally administer the ozonated olive oil into the fissure. I believe that this is a better way to go about this, because a fissure is basically like a tiny wound on the skin, on the outside of your anus. And so basically, if you would to introduce a catheter with already a fissure being present there, then I believe that through the catheter you could possibly make the fissure worse, or it could be quite uncomfortable. And I believe that just applying ozonative olive oil is a much gentler way to go about this. So I actually had this problem, and this worked pretty well. Ozonated olive oil just applied topically. So yes, so the best uses for rectal ozone insufflations are local colon and prostate related problems. So of course there are always exceptions, and people will contradict me and they say, hey, whenever I do rectal ozone insufflations, I feel a great systemic effect, my mood clears up, I can think better, I have a surge of energy, and I definitely feel that it works also systemically. And I totally believe you. But if that is the case, then I believe that the reason for this is probably because you're eating a diet which fuels inflammation. And so the inflammation is then situated in your digestive tract, in your colon. And then when you do rectal insufflations, then the rectal insufflations basically take care of the inflammation. So they remove the inflammation, they basically put out the fire. And by removing the inflammation in your digestive tract, you feel this also systemically. So it is probably not so much because the ozone enters the portal vein and then is transported into the liver, and then from the liver into your general blood circulation, but simply because it just removes the inflammation in your colon. And so if this is the case, then I believe in many cases this is an indication that people should just change a diet, and it's just a probable sign that they're eating foods which increase inflammation. So the best way to go about this problem, in my opinion, is to remove foods which do this. In many cases, this is number one, this is sugar, and this can be all types of sugar, not just white sugar, but also brown sugar, cane juice, agave nectar, honey, like anything that can increase your glycemic index can also fuel inflammation. Then the next are grains, so high carb foods, and of course gluten containing grains as well. So in many cases those are responsible for sapping us of energy. And when you do rectal ozone insufflations, you basically put out this inflammatory fire and you feel better. So now an example that I mentioned before, how the belief in rectal ozone insufflations as a powerful systemic treatment, how this can sometimes end up in a rather tragic situation. So I have learned one time about a man who was diagnosed with brain cancer, and for some reason he didn't want to go the conventional route, or maybe this was not possible in his case, and so he opted for ozone treatments that he was doing at home. And what he did were rectal insufflations. So he heard about this very wrong idea, as I believe, that rectal insufflations are a powerful systemic treatment, and so that's what he started doing. And of course it didn't work, and the cancer progressed. And now this is one case, this is one example how this belief in rectal insufflations being a strong systemic treatment can be quite tragic, because in the same time that he did rectal insufflations, and this is the only thing that he did, he could have done ear insufflations, or he could have done intravenous ozone treatments, and he could have increased his chances of seeing a benefit from them. Whereas with rectal insufflations, this was basically doomed to fail from the start. Now again, I'm not saying that if he had done ear insufflations or intravenous ozone treatment that his brain cancer would have resolved for sure, but I believe that his chances of seeing a success would have been much, much greater for sure. So I believe this is how to use rectal ozone insufflations in the most effective way. Those are the best uses for rectal ozone insufflations. So basically anything that is prostate and colon related. In those cases, you absolutely want to use rectal ozone insufflations. For any other things, you want to look into other options. If you're a woman and if you want to have a systemic treatment that you can do at home, then look into vaginal insufflations. If you're a man and you want to treat yourself systemically at home, then look into ozone saunas, ozone body bag, drinking ozonated water. Also in combination, you can combine it with rectal ozone insufflations, but not do them on their own. Let me know your experience with rectal ozone insufflations or any other home ozone treatments. So leave a comment below. Or if you think that I'm talking nonsense, then also let me know in the comment below. Otherwise, I'll see you in the next video. Thank you very much for watching. See ya.